Now we're going to discuss about the female internal organs. So we're going to discuss about fallopian tube. We're going to discuss some basic points about the ovary, and we're going to discuss in detail about the uterus. Okay, right. So now first fallopian tube. Now what are the parts of the fallopian tube from medial to lateral? Now from medial to lateral, what are the parts of the fallopian tube? Number one, interstitial part. Now, interstitial part of the fallopian tube, it is the part of the fallopian tube which is present inside the uterus. Okay. Now, the interstitial part, it measurements roughly around 1.2 centimeter. Okay. I told you, it is a part which is present inside the uterus. It is a part which is present inside the uterus. Okay. And please remember, it is the narrowest part of the fallopian tube. It is the narrowest part. Okay. And this interstitial part of the fallopian tube, that is the one which acts as the anatomical sphincter. That is the one which acts as the anatomical sphincter. Okay. Right. Next, our isthmus. See, isthmus measures roughly around 2.5 centimeter. And it is the second narrowest part. It is the second narrowest part of the fallopian tube. Second narrowest part of the fallopian tube. And the isthmus, that is the one which acts as the physiological sphincter. That is the one which acts as the physiological sphincter. Right. Next, the ampulla. Now, ampulla, which measures about 5 centimeter, and we know that in the ampulla of the uterus only, fertilization takes place. So, fertilization which takes place inside the ampulla of the fallopian tube, and that is the widest part. That is why the fertilization is taking place at the ampulla of the fallopian tube. That is the widest part. Okay. And last one, it is the infundibulum part. Again, infundibulum part, which is measuring about 1.25 centimeter. Now, in the infundibular part, we have a fimbriae. Now, this end is called fimbrial end. This end is called fimbrial end. And this end is called uterine end. So we have two ends, uterine end and the fimbrial end. The uterine end is roughly around 1 millimeter. The uterine end is roughly around 1 millimeter, whereas the fimbrial end, which is roughly approximately around 3 millimeter, and this end communicates with the peritoneal cavity. So fimbrial end, please remember, which communicates with peritoneal cavity. Okay, right. So these are the various parts and some basic points about the fallopian tube. Okay, right. So now some more points. Now, what is the most common site of the ectopic pregnancy? Ectopic pregnancy is most commonly seen in ectopic tubal pregnancy is most commonly seen which part of fallopian tube? Very good. Ampulla of the fallopian tube. Okay. Right. The most common site of tubal rupture, isthmus. Anatomical sphincter, I told you, interstitial part. Physiological sphincter, isthmus. Very good. Now, what is the blood supply of the fallopian tube? Fallopian tube is supplied by both uterine artery and ovarian artery. Medial 2/3 by the uterine artery and lateral 1/3 by the ovarian artery. Next, lymphatic drainage. Lymphatic drainage, para-aortic nodes, but the lymphatics around the isthmus will be draining into superficial inguinal nodes. This is very important. Okay, right. So these are the points you have to know about the fallopian tube. Next, ovary. See, ovary, we're going to discuss about the location of ovary, ligaments of ovary, and the blood supply. Okay. Now, location of ovary. See, ovary is located in the ovarian fossa. Ovary is a gonad. So ovary is located in the ovarian fossa. Now what is the boundary of the ovarian fossa? See, ovarian fossa, now we're going to draw one line diagram. Now this is our external iliac vessel and this is our internal iliac vessel. External iliac, internal iliac and the common iliac. This is common iliac dividing into external iliac and the internal iliac. Okay. And ovary will be here like this. Ovary is present here like that. Behind the ovary, we see one tube. That is our ureter. So this is front side. This is anterior. This is posterior. Now anteriorly, ovarian fossa boundaries. The anterior boundary of the ovarian fossa, we have one vessel. Which vessel? External iliac vessel. External iliac vessels present in anterior to the ovarian fossa. Posteriorly, we have internal iliac vessel and ureter. Okay. Now, one more structure that is on the lateral wall. Okay. Now, in the lateral wall, we have obtruder artery, obtruder vein, and the obtruder nerve. So, lateral wall, we have obtruder nerve and vessels. Okay. Now, why we have to know this relation? Obtruder nerves and vessels. Now, obtruder nerve, please put one small box and then write. Obtruder nerve, it is a nerve of medial compartment of the thigh. Obtruder nerve, it is a nerve of the medial compartment of thigh. So now in the case of ovarian pathology, the nerve in the lateral wall, which nerve? The obtruder nerve is irritated. So patient have referred pain to the, very good, medial side of the thigh. So in ovarian pathology, which nerve is stimulated? Obtruder nerve is irritated and the pain referred to the medial side of the thigh. Okay. Yes. Shall we proceed? Now this is the boundary and the applied of the ovarian fossa. Now see the actual diagram. So this is a diagram. This is our front side, external iliac vessel. Back side, this is our internal iliac vessel. Internal iliac vessel. And this is our ureter. And the lateral wall, can you see the obtruder nerve and vessels? Yes. This is the boundary of the ovarian fossa. Next, ligaments. Now we have two ligaments for the ovary. One is ligament of ovary and suspensory ligament of ovary. This is ligament of ovary and this is suspensory ligament of ovary. So we have two ligaments. Okay. Right. So now, what is ligament of ovary? Now ovarian ligament or ligament of ovary, it is a remnant of, yes, very good, proximal part of gubernaculum in female. So gubernaculum in male, I told you development itself, that is helping for descent of testis. So gubernaculum in female, the proximal part of gubernaculum in female forms ligament of ovary. Now the distal part of gubernaculum in female forms round ligament of uterus. Okay. So proximal part of gubernaculum in female forms ligament of ovary. Distal part of gubernaculum in female forms a round ligament of uterus. Okay. Right. And this ligament of ovary is coming from ovary. It is attaching the ovary to the cornua of the uterus. Cornua of the uterus is nothing but the lateral angle of the uterus, extending from the ovary to the lateral angle. Okay. Right. Now we have one more ligament, that is our suspensory ligament of ovary. Suspensory ligament of ovary, which conveys neurovascular structures. Neurovascular vascular structures. Okay, these are the ligaments for ovary. Right. Next, what about the blood supply? Now, what is the blood supply? See, blood supply, the ovary is supplied by ovarian artery. Ovarian artery is a direct branch of abdominal aorta. Fine. Now, what about the venous drainage? Venous drainage is very important. See, right ovarian vein, which is draining directly into IVC. Okay. Whereas the left ovarian vein, which is draining into left renal vein. This is very important. Okay. So, right ovarian vein is draining into IVC and left ovarian vein draining into left renal vein. Okay. So, please don't forget these two. Last one, lymphatic drainage. Lymphatic drainage, they go to pre-aortic and para-aortic nodes. Pre-aortic and they also go to para-aortic nodes. Okay, right. So that's all about the ovary. Now we're going to see the boundary of ovarian fossa. It is very difficult, but don't worry, we have animation. Now we're going to see the boundaries of ovarian fossa. Now before that, yes, see here, that is our uterus. You're seeing the uterus clearly. Yes. And you are seeing the ovary also. That is our, yes, ovary. Now ovary is situated in ovarian fossa. Okay. Now this is our external iliac vessel in front of the ovary. And behind the ovary, you are seeing the internal iliac vessel. Behind the ovary, you are also seeing one more tube there. That is our ureter. Now in the lateral wall of the ovary, yes, you are seeing the vessels and the nerves. What are those? Yes, see here, that is our obturator vessels and the obturator nerve you are seeing there. So that is why in the case of any ovarian pathology that will compress this nerve, the obturator nerve, so patient will have pain in the medial side of the thigh. Now this is the boundary for our ovarian fossa. In front, external iliac vessel, behind internal iliac vessel and ureter, and in the lateral wall, you are seeing obturator nerve and the obturator vessel. See here, the ureter is passing behind. Please don't forget, ureter is passing behind the ovarian fossa. This is the animation for the boundary of ovarian fossa. Now next we're going to discuss about the uterus. So now we're going to discuss about the uterus. So uterus, some basic points first you have to know. What is the shape of the uterus? Uterus is a pyriform shaped organ, right? Measurements and all you won't get in the exams. For the completion sake, I am saying 3.5, length 2.5 into 1.5. Now, what is the lining epithelium? The lining epithelium is simple columnar epithelium. Now, what is the location? It is located in the lesser pelvis between bladder and the rectum. It is present between bladder and the rectum. Okay, right. So now we're going to see the parts. What are the parts of the uterus? Now we have the fundus of the uterus, body of the uterus, and the cervix part. Okay. Now at the junction of body and the cervix, we have one more part, and that part is called isthmus. So first we're going to discuss about the isthmus. Okay. So what is isthmus? Isthmus, it is the part which is present at the junction between the body and cervix. Okay. Right. Now during pregnancy, this isthmus only forms the lower uterine segment. This isthmus is forming the lower uterine segment during pregnancy. And this isthmus exactly present between the anatomical internal os and histological internal os. That is the location of the isthmus. Isthmus, I told you roughly, it is present between the body and the cervix part. Now, what is the exact location of the isthmus? The exact location, it is present between anatomical internal os and the histological internal os. Now, what is anatomical internal os? The anatomical internal os, it is nothing but the part where the broad uterine cavity becomes the narrow cervical canal. The broad uterine cavity becomes narrow cervical canal. That is called internal os, anatomical internal os. Now, what about the histological internal os? Now, histological internal os, it is a transition from It is an area where epithelium is a transition from low columnar to high columnar. The epithelium is transition from the low columnar epithelium to the high columnar epithelium. That part is called histological internal loss. Epithelium is changing. Okay. Now in the cervix, it is simple columnar only, but they are high columnar. Okay. So histological internal loss, it is present below the anatomical internal loss. Clear? So now isthmus of the uterus is present between anatomical internal loss and the histological internal loss. Measurement roughly around 0.5 centimeter. Okay. Right. Next, we're going to start with the fundus of the uterus. Now, the fundus of the uterus, it is the convex part. The fundus of uterus is covered with the peritoneum. Okay, and which is situated above the cornua of the uterus. Now, this is the cornua of the uterus. Cornua is also known as the lateral angle of the uterus. Okay, so the fundus of the uterus present just above the cornua. Okay, and in the fundus, do you see uterine cavity? No, no uterine cavity. No uterine cavity is present in the fundus. Okay, right. So these are the points you have to know about the fundus of the uterus. Very simple. It is covered with the peritoneum, and you don't see the uterine cavity. And you see this is a part. Fundus is a part above the lateral angle, above the cornua of the uterus. Now, what is cornua? I told you cornua is nothing but it is the lateral angle of the uterus. It is nothing but it is the upper part of the lateral border. Cornua is present at the upper part of the lateral border of the uterus. Now, in the angle, we have three structures attached from anterior to posterior. Again, in the INACT exam, they may ask you, what are all the structures? Arrange the structures sequentially, attaching to the angle of the uterus from anterior to posterior. Likewise, they may give you the sequential arrangement question. So, we have three structures attached to the angle of the uterus, cornua of the uterus. Three structures. Now, from anterior to posterior, what are those? Anterior to posterior, mnemonic is Raphael is a mnemonic. So, Raphael is a mnemonic. RFL from anterior to posterior. The anterior-most structure in the lateral angle is the round ligament. Next, fallopian tube. Last one, ligament of ovary. Okay, Raphael Nadal. Yes. So, from anterior to posterior, round ligament, fallopian tube, and the ligament of ovary. Mnemonic, Raphael Nadal is the mnemonic. RAFEL. RFL. Okay, right. So, see the diagram. So, in the diagram, yes, this is our round ligament of the uterus. This is the fallopian tube, and this is the ligament of ovary. Okay, right. Now, round ligament, I told you already. The round ligament is nothing but it is the remnant of distal part of gubernaculum in female. Just now I told you. Now, this round ligament, it is the ligament which maintain the uterus in the anteverted and the anteflexed position. Okay, so round ligament of the uterus, it is the ligament which maintain the uterus in the anteverted, in the anteflexed position. Now, what is meant by anteversion and anteflexion? Now, what is meant by anteversion? See, anteversion is nothing but it is the angle between cervix and vagina. That is the anteversion. And the angle is 90 degree. What is anteflexion? Anteflexion, it is the angle between the body of the uterus and the cervix of the uterus. And the angle roughly measuring around 120 degree. Okay, so anteversion and anteflexion. Clear? So anteverted uterus means the angle between cervix and vagina 90 degree. Anteflexion, angle between body and cervix around 120 degree. Okay, so uterus is maintained in anteverted and the anteflexed position by round ligament. Now we're going to see the body of the uterus. The body of the uterus. Now this is the body of the uterus. So the body of the uterus is present between the fundus and the cervix, which is present between the fundus and the cervix. Now in the body, yes, we have the uterine cavity. So uterine cavity is present. In the body, you see the uterine cavity. Now what is the relation of the body of the uterus? Now in the front side, see here. Now this is the isthmus. This is cervix. Now this is isthmus. I told you isthmus is the part present between the body and cervix. Now anteriorly, in the body of the uterus, the peritoneum is covering only up to isthmus. Now this is front side. See the diagram? I am marking this as A. There is anterior. Now this is peritoneum. Can you see the peritoneum here? So peritoneum is reflecting here. Peritoneum after covering is reflecting here like this. But see on the back side, posteriorly, the peritoneum, it is going little down all the way to the posterior fornix. That is a main difference. Anteriorly, the peritoneum is present only up to isthmus. So anteriorly, peritoneum is present only up to the isthmus of the uterus. Okay, and reflected to bladder and reflected to superior surface of the bladder. Reflected to superior surface of the bladder to form utrovesicular pouch. To form utrovesical pouch. Okay, so anteriorly, the peritoneum is covering only up to isthmus and then reflected to superior surface of the bladder to form utrovesicular pouch. But posteriorly, I told you the peritoneum is covering some more parts below. The peritoneum is up to this part. Can you see this part here? I am shading with yellow color, no? That is the posterior fornix. Okay. So posteriorly, peritoneum is covering up to the posterior fornix. I am talking about this area. That is a posterior fornix of vagina. Okay. So posteriorly, peritoneum is covering. Peritoneum is present up to the posterior fornix of vagina. Posterior fornix of vagina and reflected to rectum and forms recto-uterine pouch. And forms recto-uterine pouch. Okay, right. So anteriorly, the peritoneum is present only up to isthmus and then covered to the superior surface of the bladder and forms utrovesicular pouch. Posteriorly, it is covering up to posterior fornix of vagina, peritoneum, and then reflected to rectum and forms the, yes, recto-uterine pouch. Now, recto-uterine pouch is also known as pouch of Douglas. Recto-uterine pouch is also known as the pouch of Douglas. Okay, pouch of Douglas. And please remember, that is the most dependent pouch. That is the most dependent pouch of the peritoneal cavity in the standing position, in the erect posture, in the standing position. Okay, that is the most dependent pouch in the standing position, pouch of Douglas. Okay, sir. Now, this patient is having some fluids in the pouch of Douglas. Now, how to drain this fluid? Now, if you pass the needle via posterior fornix, then easily you will get the access to the recto-uterine pouch or pouch of Douglas. So, please remember, a fluid in the pouch of Douglas, fluid in this pouch is drained via posterior fornix of vagina. Via posterior fornix of vagina. Okay? Yes. Right. Now, what are the structures present on the lateral side of the body? In the lateral side of the body, in the lateral border, we have broad ligament. Laterally, we have a broad ligament. Okay, and we also see artery. Which artery? Uterine artery. And the upper part of the lateral border, we have, what is that? Angle of the uterus. In the upper part of the lateral border, yes, we have the angle of uterus. And just now I told you, in the angle of uterus, we have three structures attached from anterior to posterior. Round ligament, fallopian tube, and the ligament of ovary. Yes, very good. And that's all about the body. And we're going to see the layers now. Now, in the body of the uterus, we have three layers. What are those? Perimetrium, myometrium, and the endometrium. We have three layers. Now, perimetrium is also known as serosel layer, the outer layer. Myometrium, it is a middle layer. Myometrium, you know that is the muscular layer. Now, we have muscular layer is made up of three muscles. Myometrium is having outer longitudinal muscle, inner circular muscle, and in the middle layer, we have interlacing muscle fiber. What is interlacing muscle fiber? Interlacing fibers. You write this, I'll draw a diagram for this. So, myometrium is made up of three layers. Outer longitudinal muscle present, inner circular muscle present, and the middle layer, we have interlacing muscle fiber. Now, what is the significance of interlacing muscle fiber? Now, this is the muscle fiber, interlacing muscle fiber like this. Now, this is middle interlacing muscle fiber. Interlacing fibers in the middle layer. Now, in between the interlacing muscle fibers, the vessels are passing, the arteries are passing. So, arteries are present, arteries are passing between the interlacing muscle fibers. Passing between interlacing muscle fibers. Okay, now these muscle fibers contract, the interlacing muscle fibers contract. What happened? Which will constrict the blood vessels. So, these interlacing muscle fibers are also called living ligatures. They are also called living ligatures. Clear? So, when these muscle fibers contract, they constrict the blood vessels, and that is why the interlacing muscle fibers are also called as living ligatures. Okay? Right. That's all about the muscular layer. Next, the innermost layer is called endometrium. Now, the endometrial layer, which is lined by simple columnar epithelium. The endometrial layer is lined by simple columnar epithelium. Okay. Now, the endometrium is having two zones. That is basal layer and the functional layer. The basal zone and the functional zone. So, endometrium is having the two layers, basal zone and the functional zone. Now, basal zone, it is the deep layer. Functional zone is the superficial layer in the endometrium, which is superficial. Now, in the basal layer, mitotic activity is present. Mitotic activity is present. In the functional zone, the mitotic activity is absent. The basal layer does not undergo any change. Does not undergo any change during menstruation. Does not undergo any change in the menstrual cycle. Whereas functional layer, yes, they undergo change. They undergo change during menstruation. Okay, fine. Now, what about the blood supply? The basal layer is supplied by the basal artery. The basal artery supplies the basal zone, whereas the functional zone is supplied by spiral artery. Okay, so basal artery supply the basal zone, whereas the spiral artery supply the functional zone. Now, these are the two layers in the endometrium of the uterus. Okay, and next we're going to discuss about the cervix. Okay, now cervix, it is the lower cylindrical part of the uterus is called the cervix. The cervix which projects into vagina. So, cervix is having two parts. Now, see here. Now, this is the cervix. This part is the cervix. I will mark here. Now, This part is cervix. Okay. So the cervix is projecting into vagina, and the cervix is having two parts. Now this one, number one, and this one, number two. So what are the parts of cervix? The one which projects into vagina and above that. So the parts of the cervix are supravaginal part and the vaginal part. So parts of the cervix, supravaginal part and the vaginal part. Supravaginal part and vaginal part. Okay. So these are the two parts of the cervix. Now what are the relations? Now see the diagram. Now again, front side, anteriorly. Now anteriorly, cervix is not covered by peritoneum. Why, sir? I told you just now. The peritoneum is covering the front side only up to isthmus. Where is the cervix? Cervix is present just below the isthmus. Yes or no? Yes. So anteriorly, no peritoneum. The peritoneum is not covering in the front side of the cervix. Now what are the relations? Now the supravaginal part and the vaginal part. The supravaginal part, see the diagram here. Now anteriorly, the supravaginal part is related to this one. What is that? It is a bladder, posterior surface of the bladder. So anteriorly, the supravaginal part is related to bladder, posterior surface of bladder. Related to posterior surface of bladder. Okay. Whereas the vaginal part is related to this area. The vaginal part of the cervix is in front of that. What we have? Fornix, anterior fornix of vagina. So the front side, we have anterior fornix. Okay. Now what about the posterior side? Now posteriorly, see the diagram. Posteriorly, we have peritoneal covering. Why? I told you, posteriorly peritoneum is present up to posterior fornix of the vagina. Okay. And then reflected to rectum, forming recto-uterine pouch. So posteriorly, so we're going to write the posterior relations. So posteriorly, yes, the cervix is covered with the peritoneum. Yes, peritoneum is present. Again, what is the relation? The supravaginal part is related to recto-uterine pouch, and the vaginal part is related to posterior fornix of vagina. Okay, right. Now, what about the lateral side? Laterally, cervix is related to transverse cervical ligament, uterine artery, ureter, and lateral fornix of vagina. Lateral fornix. Okay. Now, these are all the relations of the cervix. So now we discussed all the parts of the uterus: fundus, body, isthmus, and the cervix. Completed. Now next we're going to discuss about some ligaments. Okay. Now what are the ligaments supporting the uterus, maintaining the uterus in that position? Already we discussed about the round ligament. What is round ligament? Round ligament is nothing but it is a remnant of the distal part of gubernaculum in female. The proximal part of gubernaculum in female forms ligament of ovary. Okay. Now I told you the round ligament, it is the ligament which maintain the uterus in the anteverted and anteflexed position. Ligament which maintain the uterus in the anteverted and anteflexed position. Okay. Right. Now what are the other ligaments which is helping for the support of the uterus? What are those? Triradiate ligaments. What are those? Pubocervical ligament, uterosacral ligament, and transverse cervical ligament. You see one by one. Pubocervical ligament. So pubocervical ligament is from the posterior surface. The name itself you have a clue. Pubocervical. The posterior surface of the pubis bone up to cervix. Pubocervical ligament. Okay. Right. Now uterosacral ligament. Uterosacral ligament from the cervix up to the sacrum bone. Now uterosacral ligament, it is the ligament which counteracts with round ligament. uterosacral ligament, it is the ligament which counteracts the round ligament of uterus. Okay. Now, due to overactivity of uterosacral ligament, due to the overactivity of uterosacral ligaments, the uterus is bending on the backside, and that is called retroverted uterus, which in turn result in retroverted uterus. Okay, right. Next one, transverse cardinal ligament or transverse cervical ligament. Okay, now transverse cervical ligament is also known as McEnroth's ligament. McEnroth's ligament. Okay, transverse cervical ligament from cervix to the lateral pelvic wall. From cervix to the lateral pelvic wall. That is a transverse cervical ligament or McEnroth's ligament. See, it is the ligament which maintain the uterus. It is the ligament which prevent the prolapse. It is the main ligament in preventing the prolapse. Prevent the prolapse. Okay, that is why this ligament is called what ligament? Cardinal ligament, main ligament. Okay, right. But that ligament does not give any support to the uterus. That is the broad ligament. So broad ligament, it is nothing but it is a peritoneal fold. Okay, and broad ligament, please write, it is a peritoneal fold which is not giving any support to uterus. Which is not giving any support to the uterus. Okay, now what are the parts of the broad ligament? So broad ligament is having three parts: mesometrium, mesosalpinx, mesoovarium. So to uterus, to fallopian tube, to ovary. So mesometrium, mesoovarium, and mesosalpinx. These are three parts of broad ligament. And next one, what are the structures present in the broad ligament? Okay. Now what are the contents of the broad ligament? We have two tubes. What are those? Number one, fallopian tube. Number two, ureter. Two arteries. What are those? Uterine artery and the ovarian artery. Uterine artery and ovarian artery. Two ligaments. What are those? Ligament of ovary and round ligament. And three embryological remnants. What are those? Paruphoron, epuphoron, and Gartner's duct. These are the various structures present in the broad ligament. Okay, right. So that's all about the ligaments of uterus. Now two more topics in the uterus: blood supply of the uterus and lymphatic drainage. Now uterus is supplied by the uterine artery and also by ovarian artery. Ovarian artery and the uterine artery. Ovarian artery, we know, direct branch of abdominal aorta. Uterine artery is a branch of anterior division of the internal iliac. Uterine artery is branch of anterior division of internal iliac artery. Now uterine artery runs medially. Now course, again, you won't get any question from the course. For the completion sake, we are writing. Uterine artery runs medially and enters broad ligament. Enters broad ligament at the level of internal os. Now just 2 centimeter lateral internal os, 2 centimeter lateral to internal os, the uterine artery is passing above the ureter. So ureter will be here like this. That is the ureter. Okay. So 2 centimeter internal os, the uterine artery pass above the ureter and runs along the lateral border. And finally, again, the uterine artery also running along the fallopian tube, anastomose with ovarian artery. Okay, right. Now the point is how the uterine artery supplying the uterus. That is the question. Now expected question for the coming INCT exam. So uterine artery, while running in the lateral border, it gives arcuate arteries. Now this arcuate arteries which is going in front and behind. Now it is a cut section diagram. Okay, we have taken the cut section, and this is the front side. For example, front side anterior and posterior. Now uterine artery on the lateral side. Now uterine artery, I told you it is giving arcuate artery, which is passing in the front side and also in the back side. So this is called arcuate arteries. Arcuate arteries in the front side and back side, and these two arcuate arteries anastomose with each other in the front side and back side. Now from the arcuate arteries, we have straight vessels. Now these vessels are called radial arteries. So radial arteries are the straight vessels arising from arcuate artery. Now these radial arteries, they anastomose. Where, sir? In the myometrium. This radial artery pierce the myometrium of the uterus, anastomose, and form stratum vasculaire, and form one anastomosing circle and form stratum vasculaire. Now from the stratum vasculaire, we have two arteries. One is our basal artery, another one is the spiral artery. Now basal artery, which will supply the basal zone of the endometrium, spiral artery which supply the functional zone of the endometrium. Okay, so basal artery, basal zone of the endometrium, and spiral artery supply the functional zone of the endometrium. Now this is about the blood supply of the uterus. Okay, so uterus, how the uterine artery supplying the uterus, arrange the arteries in a sequence. Likewise, you may get the question. So number one, uterine artery. From the uterine artery, you get the arcuate artery passing in front side and back side. Now from the arcuate artery, we have radial artery. Now radial artery forms stratum vasculaire, plus stratum vasculaire, basal artery and spiral artery. So arteries in sequence. So first uterine artery, and then arcuate artery, and then your radial artery, and then stratum vasculaire, and then basal artery and the spiral artery. Okay, this is the artery pattern, sequential pattern of the arteries. Okay, again expected question for the INSET exam. Next one, lymphatic drainage. So lymphatic drainage of the uterus. Now we're going to see the lymphatic drainage for three areas. We're going to divide the uterus into three areas. Okay, upper part of the body, lower part of the body, and cervix. So the lymphatic drainage, the upper part of the body, including fundus, and the lower part of the body, and the cervix. Now the upper part of the body, the lymphatics are draining into pre-aortic nodes and the para-aortic nodes. Pre-aortic and para-aortic nodes. See here, from here, the lymphatics are draining into pre-aortic and the para-aortic nodes. Now, very important point, the lymphatics along the lateral angle of the uterus. The lymphatics from the lateral angle draining into superficial inguinal nodes. So, lymphatics from the lateral angle of the uterus, it is draining into superficial inguinal nodes. Very, 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 very important. Okay, right. Now, lymphatics from the lower part of the body draining into external iliac nodes. Lymphatics from the lower body, it is draining into external iliac nodes. Okay. Now, the lymphatics from the cervix, it is going to all the areas except superficial inguinal nodes. That is very important. It is going to external iliac nodes. Lymphatics from the cervix, I am saying, going to external iliac nodes, internal iliac nodes, sacral nodes, obturator nodes, but it is not going to superficial inguinal nodes. So lymphatics from cervix, it is going to external iliac nodes, internal iliac nodes, sacral nodes, and obturator nodes. The point is, lymphatics from the cervix, it is not draining into superficial inguinal nodes. So cervix, it is not draining into, the lymphatics not drain into superficial inguinal nodes. This is very, 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 very important. Okay, you may think the cervix is close to the inguinal region. Lymphatic from the cervix is draining into superficial inguinal nodes. No, lymphatics from the cervix, it is not draining into superficial inguinal nodes. Okay, right. And by this, you are completing the uterus. So that's all about the female internal organs.